Hey everyone. I'm going to send out the PowerPoint, but I think there's a bit of nuance in this, so I wanted to go ahead and also send out the video version of it too. That way you can watch it whenever you want to. Again, this is all my opinions. I didn't really discuss this with any of my classmates. This is my experience. I think that you guys all know I have a pretty good relationship with the majority of my class, and I'll say that they all learn different, and they all had different experiences in the fall. Some people had a harder time um, getting through um, the fall in the spring than they did in the summer. It's a variety of experience. I really recommend reaching out to your student mentors, and even your friends, if your friends have contact with their student mentors, getting their opinion on these things. So now that we're kind of on our way, let's go ahead and get rolling here. And okay, all right. I had a great time in the fall and the spring semesters. Actually, I felt like I was studying all the time in the summer, the first summer. And so I really enjoyed the fall and the spring. I felt like it was stuff that I was really interested in learning. It didn't require so much time and effort because it all kind of overlapped. All that information kind of made sense. Um, I also like made an effort to have a social life. So I know a lot of people come to PA school with this idea that like I'm just gonna put my head down and grind, and that sounds great. But you're there for 15 months, and it's a hard 15 months, and so you need community, you need people. So creating a social life with groups on campus, or even like being able to FaceTime your family, friends, going home certain weekends, like after exams, would be really, really helpful. I've already harped about counseling, but I threw that in there. So you can have a great time in the fall and the spring too. I My recommendations are that you come into fall with an open mind. You're excited about the material, right? We're finally getting to learn about medicine, like the stuff that we actually went to PA school for. So just come in excited. Be prepared with the study methods used in the summer. Obviously, if they worked for you, great. You should use them until they don't work anymore. But if they're, if you came out of the summer, you're like, I don't really know what I was doing is working. It was just kind of survival until I ended. Then maybe it's time to look at that over again and see what kind of method you can try, at the beginning of the fall. You need to have like a physical health plan. Um, your health and wellness coordinator seems to be doing a fantastic job keeping you guys in the loop on like things that are going on around town and some exercise plans. There's a free gym on campus. There's multiple gyms between New Tazewell, Harrogate, Millsboro. Um, that free one on campus. Walks, the soccer fields, pickleball. Do something. Be physically active. Um, and make sure to take breaks. I'm not just talking about like in the day, like not studying all day. I mean, like take like a day off or take a weekend off. Go out to Knoxville for a weekend with some friends. You need time. Just like people who work full time need PTO, this is a full time job for you, if not more so, because you're spending more than 40 hours doing this stuff a week. So, okay, so recap. You've accomplished a lot so far. You guys have taken a dozen exams, well over a dozen exams, um, and you passed the summer, which is super fantastic. So if you look at it this way, you guys have already accomplished a lot of stuff. You've taken a lot of exams. I think you had to do a brochure. That's at least what you had to do. So um, you should be proud of what you've accomplished. The only thing that you can do to kind of like help bolster moving forward is like looking back and seeing on how well you've done to this point. So um, look back, you've accomplished this, and there's some more things to accomplish, but this is worth like setting a flag down and saying like, look at all that stuff I did. So over the fall, you're going to take, they probably already covered this with you, but PathPhys 2, ClinMed, Pharm, CATS 2, and research methods. And then if it goes in the same order that it went for us, you'll take on all of those like heme, endocrine, renal, um, fun stuff. I didn't physically go through and count because I don't think that you do a CATS exam for hematology because there's not really any physical exam skills to learn. I think I might have already accounted for cats, but between all your exams and you're finally getting to do OSCEs and Sims, and your physicals, I think you do one practical, maybe two. You guys will be busy, so you guys have a lot to look forward to. This is the medicine part, so it can be really daunting, but it's actually what you want to learn about. So, what's the difference between the summer and the fall? The fall is so much more fun to study for. Um, I also felt like in the summer that I had to make almost all of my study material because there's not like, Dr. Gassler with anatomy teaches it in a certain way. So I wanted to use pre-made Anki decks for anatomy, but it didn't emphasize the stuff that he said was important. So that kind of fell out the window. But now that we're moving into the fall, PA schools all have to teach the same stuff in terms of like the material for you to pass the PANs. So you can use the same resources that everyone else is using to learn, which helps so much because you could go on Etsy and buy like, cardiology, PA school, charts. Don't recommend doing that, but you could if you wanted to. You can do that for EORs too. But I think the better part about this, like why I said that I got to study less over the spring and the fall, was because everything kind of lined up. So if you notice, like over the summer, like Cats was kind of all over the place. You're learning how to write notes, and Path Phys, they're just kind of like doing a broad base on a little bit of everything. Um, Farm was just kind of like getting your grounding, but now you're going to learn like Path Phys, clinical medicine, physical exam skills, and pharmacology all on the same stuff. So while you're in the endocrine block, you're going to learn about all the things that affect the endocrine system, right? Like what medications can be used to mimic even something like like hyperthyroidism, right? Like how to stimulate your thyroid or how to destimulate your thyroid. Like you're going to learn about all these things and how they connect. So it's going to help your time management so much because even when you're studying, pathophysiology, you're also studying for cats in a way, and then vice versa. If you're studying pharmacology, you're getting bits and pieces of ClinMed. So everything overlaps. And so you need to have your study system kind of be built in that way that everything, I'm not just studying for path for like a day and I'm not just studying farm, but I'm kind of hitting bits and pieces of everything because they're all going to come together really, really well. So I know that I don't know what happened during your guys' meeting. I heard that several people had gotten overwhelmed. So let's take a deep breath for a minute. This can be a very overwhelming transition. Um, it scared everybody. I'll be quite frank with you. There was a PowerPoint that was given a couple of years ago that I saw that like made me super anxious, and I had to go talk to a professor. I was like, "Is the fall really this bad?" Um, and I don't think that they would be doing their job well if they didn't scare you a little bit. The fall is very hard. It's a different transition. I think for those of you that I've actually talked to, the amount of work that you do in the fall versus the summer is substantially more. You have a lot more PowerPoint slides to get through. You have a lot more stuff to try to cram in your head. So it is a little bit harder in that sense. So kind of in the same sense that they would rather you come in, a little anxious, gas on the foot on the gas pedal. I think you should keep that in mind too, that like they're trying to make sure that you don't come into it slacking off. If the summer was really, really easy for you, that's fantastic. Don't come into the fall thinking that it's going to be just as easy as this summer, right? We're going to put our foot back on the gas and we're going to push down as hard as we can until the engine catches up. And that's what you need to start with. So in comparison, whenever you guys started PA school, you had the same level of anxiety, if not a little bit less, right? Or a little bit more comparative to now, because you didn't know what to expect in PA school. Now you kind of have an idea. You have a semester under your belt. Obviously you're doing something right to stay in school. So you've proven that you can handle the stress and that, looking back, the summer wasn't as bad as everyone made it sound like, I'm so sure. So believe in yourself, look back and acknowledge that you accomplished something great. You don't need to learn everything. You've only got 3 weeks to try to synthesize all this material. It's going to be impossible. And if you come into this thinking that you're going to be able to learn everything super, super well, like you did for anatomy, right? Like you could write everything out on a whiteboard and basically memorize every insertion, origin point, whatever. It's just not practical. You don't have enough time to synthesize all this information in your head in a way that's going to stick long term. You're building a foundation here. Um, I've come to find that like even while I was studying for like my women's health block that I just did, I didn't know women's health all that well. Like coming out of the block, I did really well on the exams, but I didn't feel like I knew it really well. And so kind of looking at it again through this block, I'm like, okay, like I had a good foundation set. Like it was a decent foundation that I set. And as you study for your cumulatives and your summatives and the pack rat, and then you go on your rotations, everything is just kind of build on itself. And each time you do that, it's going to put a new layer of concrete, right? So you got like your brick and then you got the mortar, and each time you do that, you're just kind of setting a better foundation that's going to not be so shaky as things go on. So keep that in mind that you're setting a foundation now, and you cannot build a whole house in 3 weeks, but you can build a pretty decent foundation. So please keep that in mind. If all else fails, tens of thousands of people have done this process before you. A lot of people will do it after you. So keep that in mind that like normal average people for our profession, because you're all extraordinary, have done it. So just be confident that you can do it too. Okay. All right. So this is the number one thing that I heard. Remediation is not inevitable. A lot of people might experience an SPC meeting, but some people never will. And it's pretty common in PA school. A lot of people get put on academic probation. School's hard. We take over 63 exams while you're in school. Like it's not a joke. Um, Believing that you won't get below a 75 on one of them is really, really tough. It's possible. I have lots of friends that did it. I failed an exam. I got a 43% on a path phys exam for cardiology. It happens. There's just some things to keep in mind. One, you shouldn't feel alienated if you go to these meetings. The whole point is to make sure that you're doing okay, and that you don't have anything that's going on in your life. A family member passed away, or my brother got into a car accident, and they're like, okay, we saw a grade below your normal, so let's make sure that everything's okay. They want to make sure that everything that you're in control of isn't causing problems for you, like preventing your success. That's all they care about. So keep that in mind, that is their goal. Their goal is to make sure that you're doing okay. And they're going to try to help you figure out, okay, if your study methods didn't work for, this exam block, maybe you need to try something different. Their job is to help you learn. So keep that in mind, that this isn't meant to be like a punishment. They're just trying to make sure that you're staying on track. PA school is getting harder. They changed the pants this year. So in 2025, it will be completely different pants than it has been years before. They're making it harder. They're removing buzzwords. Buzzwords aren't really going to be a thing much anymore. And so they have to prepare you a little bit better. And so remediation is a part of that. It's a very normal part of PA school. Um, so I think I covered everything for remediation. It's not something you should be afraid of. Not everyone will go to remediation, but if you do, it's okay. It's a part of PA school. It's pretty normal. I would say at least 70% of my class had at least one remediation. I would consider myself a very bright student, and I had a remediation. So, don't think about it any other type of way. Okay, so this is kind of some of the stuff that we covered in the original. Um, so for books, you have like any of those like fill in the blank made ridiculously simple. Clinical pharmacology made ridiculously simple. Pathophysiology made ridiculously simple. These books are really good. And a lot of the faculty members have recommended these books. I didn't purchase them, but there were some free PDFs that I might have collected from the internet that were fantastic. Um, Really helps break it down in a very simplistic way, especially cardiology stuff. So if you're like, man, pharm's just not my thing, those books are great. People found mnemonics in them that were fantastic for like keeping all of the classes straight. So um, something to look into, maybe if that's if you find a class you're particularly struggling in. Pants Pet Pearls, I'm sure that a lot of you guys have heard of it. It's like a pretty common book in PA school. I have more on that one later. The Green Book is like the certification and recertification for physician assistants. My experience with it, it's not super comprehensive. It covers a lot of like things, broad strokes. I know Carrie Hall like swears by that book. It's a great book. But as I was studying, even for like the women's health EOR, there was a lot of stuff in there that was super important that was not in that book. So I think it's good if you use it in conjunction with other things, but other than that, it's not going to be like it's not a good standalone book unless you're writing in a lot of notes in the margin. Step one review books like first aid or whatever. Step one has a lot of information that we don't need to know. So you'd have to really kind of go through those books and figure out what's important. Some of it's been great. I watch step one review videos because I think that the things that they cover 90% of we need to know. So if you're feeling frisky and you're like, maybe I do need to know step one stuff, you can look up like women's health reviews for step one or whatever on YouTube. I'd prefer YouTube over the book. Current, I know they recommended Current to you. It is a true and true textbook. Physicians use it. That physician that I was just with uses Current. Um, it's a great textbook. It's not something that you'll probably use every day. I know that they're trying to get more students to use it because it's maybe a more I want to say clinical because it's not like it's just very comprehensive. So it's easier for you to find the information that you do need versus trying to find it in Pants Prep, Pearls, or Green Book. Everything that you need is in Current. It's not the same for Pants Prep or the Green Book. As for like Anki, you can of course make your own. A lot of my classmates did, and you can find pre-made decks too. The hard part with pre-made decks is a lot of the information in them you don't really need to know. Uh, for program testing for whenever you take your pack rat or whenever you're doing EOR, it's a little bit different because the parameters are pretty standard. But LMU still kind of and they make their own in-house exams. So and then of course, like if you got any hand-me-down decks from the class of 2025, they're probably going to be pretty good. I don't know what they changed for you guys, if they changed anything, because our class was scoring really well on exams. So, well, I'm not sure. And you guys have probably heard of like Osmosis and Picmonic and Amboss, all fantastic resources. We'll throw Smarty Pants in there too to teach you this information. Definitely would consider Picmonic or Osmosis if pharmacology is not your strength. Great pictures, great ways to learn the material. If pictures stick for you, those two are the way to go. Like Cheerio, I don't know if you guys get that one for free. We did. It's got a lot of video resources. Pretty fantastic. So definitely would consider that one. Smarty Pants, I'll just kind of dig into Smarty Pants a little bit because I don't have another slide on it. Smarty Pants is fantastic because it has everything in the blueprints for the pants, and it's got it all on certain web pages. So it doesn't look super streamlined, but it has everything that you need to know. And they also have practice questions, and it's the cheapest of all the options between all the practical application ones. So, for $80 for a year, you've got Smarty Pants, and if you're a big like internet person, you like videos, you prefer to have everything online, you can do that. People have printed out all the stuff from Smarty Pants. They have Quizlets. It's worth looking into. Cram the Pants is a fantastic podcast, has a lot of stuff for ClinMed. I highly recommend watching him on YouTube or listening to his podcast. His YouTube videos are better because he has pictures and he does like almost like a PowerPoint presentation like this. Brian Wallace, I think, is just strictly podcast, but he has a lot of other information outside of, just like what's happening in PA school, like dermatology. He's got like dermatology parts 1, 2, 3, and 4. He's got like people talking about like what happens after PA school. And, he's just got a lot of guests. So even if you're just looking for somebody to listen to, Brian Wallace is a good dude. And then, of course, like anything on YouTube, I would find, as I was studying for the cumulative, I would find people who are doing like a cardiology review because there's people who are studying for the pants that will record because as we'll kind of cover later, teaching is the best way to retain information. So they'll record themselves talking through the blueprint. It's super helpful. So, and then of course, I'm not going to dig into these practical application ones because I think I hit them later, but those are all options for you to do practice questions. The important takeaway from this is the bottom right page that for you to be successful, you need both to review and learn the material and you need practical application. We'll cover that a little bit later, but you need both. You can kind of be successful with one or the other, but your best, and you're here for your best. So your best is both. I own all three of these books. I own the Green Book, Pants Prep Pearls, Practice Questions. Practice questions are okay. I bought the book for $60. It's got like a whole free pants exam like practice, I think. It's cheap. It's much cheaper than $350 a year. So I bought it just in the case because I like books. So, I bought it. It's okay. I don't hate it. I don't love it. They're not working with NCCPA. And then of course Green Book and Pants for Pearls. I kind of covered those already. Okay, so this is a structure for Pants for Pearls if you have not seen it. So they cover, for most things, the etiology, the path is clinical manifestations, physical exam, diagnostic studies, and how you manage it. How do I treat it? This is a really good setup. I have it later, but this is how you should be setting up your notes, pretty much. Like if you're giving me the high yields, this is what you need to know. Those like 5 or 6 categories. Um, so the pros, how it's set up, fantastic, easy for people to retain, relatively comprehensive. It doesn't have everything that's on the pants blueprint. It's pretty close. It has a lot of good stuff and it has a lot of buzzwords, but it doesn't have everything you need to know. So again, Pants Prep Pearls cannot be your only study material. Um, Pants is moving away from buzzwords, kind of moving forward. They're not really doing as many. There are some things that you can't really get away from, but they're trying to move away from that. And Pants Prep Pearls was really, really good about buzzwords. So um, and you just need to know it doesn't have everything that you need to know. So just keep that in mind. There's a lot of great information in this. It is not completely comprehensive. I got this from one of my classmates. They did not give me permission to share with you guys yet, so I'm kind of waiting to see what she says. But these are her charts, and I think charts are a fantastic way to make these notes, honestly. Um, and I really just kind of followed the Pants Prep Pearls blueprint for like components of a good chart. Um, but these are really all the things that you need to know. So I would just keep these things in mind. If you're going to try the whole charting thing, I highly recommend it. Keep it really organized and make sure that you answer these because these are going to be the things that they're going to ask you questions on. So I won't stay on that for too long. Someone had asked about making your own notes versus using pre-made material. It's a toss-up and it's going to be completely subjective to you. Making your own material takes time and it can be very, very frustrating how much time you spend making your own stuff. But it's very effective in creating that foundation in your head because I know that if I were to write notes for Emily Wang and she would write notes and share them with me, or if I wrote my own notes and shared them with Emily and Emily shared hers with me, the way that I phrase my notes is probably going to sound very foreign to her because the way that things click in my brain might be very different than what clicks in hers. And so you just kind of have to keep that stuff in mind that like if you're using other people's material, they're going to probably phrase it in a way that might not like sit best in your head. Um, and don't get me wrong, like using other people's like Quizlets, Anki decks, study guides, charts, it's kind of a necessity, right? Multifaceted learning. I learned best. I'll cover that later. I didn't learn best by making these things, but boy, did I use them. Quizlets saved my butt in pharmacology. And so using other people's stuff, fantastic. But you have to find the stuff that clicks for you if you're going to use it. Yeah, a lot of people in my class split group work. Like there was a group of like 5 girls in my class that like would make charts together. One of them would go through the lecture the night before, kind of like set up like a structure for their notes for the next morning. Another girl would like be paying attention in class, writing down what the professor says is important. And then the other girls would kind of format it into charts and lists. Super effective. They all did really, really well. You as a student need to be aware of these things about what percentage of things that you're retaining whenever you're doing certain things, passive, active learning. I think that this is way too important for you guys to be in a graduate program and not have a really thorough grasp on. This is the reason why practice questions are so important because your retention rate is going to be much higher than if you were just listening to a lecture at 5%. So just keep this in mind, be thinking about different methods, about like, how you can learn, use ChatGPT to like ask it, like, can you give me examples of like discussion questions covering X topic, and it will spit out a bunch of questions for you. Meet with some friends once a week on a Saturday morning and talk about stuff that you guys learned. This is all super duper duper important, and it will be so much more helpful for you now versus having to try to catch up on it before a cumulative exam. You need to be doing practice questions. I covered this already. You need practice. You need to practice because you might know the makeup of you know, abrupto placenta, right? When the placenta just disattaches from the uterus. You might know it, I know that it's painful, but if they give you like a patient example and you're like, I have no clue, that's a problem. And so the book knowledge is there, but the application's not there. So you need the application part to connect with that book knowledge to make more connections. Because if you think about a neuron, let's think about it like an artsy way. You have a thought in this circle here. And the more times that you think about it, it's connecting to more neurons, right? Because if it needs to access that thought more often, then it needs more access points. And so the more times that you think about something, the easier it is for you to pull out. And so the more practice questions you do about, placenta previa, or the more practice questions you do about, aortic stenosis, you're going to remember the important aspects of those disease states. And so that's why practice questions are important. Green Book has some pretty mid, like the questions aren't great. Lang has pretty good questions. Cheap option if you can't afford Roche or UWorld. Smarty Pants has decent questions. I don't think that they're great. They're super niche, but it's cheap and it's a good study resource built in versus Roche and UWorld are just practice questions. UWorld is harder. It's longer questions. Their explanations are very, very good. The value for Roche and UWorld is not just that they're question banks, but that they just do a really good job of explaining to you why things are right or why they're wrong. So I would definitely, every time that you get a question wrong, flag it, and then you need to read through the explanations. The explanations are the reason why it's good, right? Because if you just know that you got it wrong, what good is that to you? But if you now know, oh, okay, I was confusing, this symptom with another disease, you made another connection, right? And you can definitely find these question bank questions on Quizlet somewhere. I've stumbled into them multiple times. So if you don't want to spend the money on it, you could probably look up like cardiology Roche on Quizlet and probably find some for free. Someone else had asked about like how we study for like cumulative exams. So you have a cumulative exam at the end of the fall and the spring semesters that kind of covers everything that you learned. Not everything you learned up to that point, right? Just that fall. The fall is its own cumulative exam. The spring is its own cumulative exam. They're split. They're completely different. You will not have any hematology questions in your spring cumulative. I'm trying to remember how many questions they had on these cumulatives. I think 100. I think they have 100 questions each, and they try to split it between each block. So you do like 75 clean medi questions, 10 path phys, 15 farm. I think that that's accurate, and they have the clean med questions split by block. So whatever 75 divided by 5 is. So however many questions that is per block. And then you have a summative at the end of your summer too that covers everything that you covered in the fall and the spring and that summer. So like emergency med, dermatology, surgery, that kind of stuff. But they split it up in the same format that the PANS is in. So like I don't know how much it is now, like 11% cardiology, 8% pulm, 7% GI. Like they do a really, really good job. And I'll tell you, I didn't write this on here. So if you're listening, good, kudos to you. The PAC-RAT was easier than our in-house cumulative exam, which is saying something. It's saying that they prepared us very, very well for the PAC-RAT. But that exam that they made was really representative of what the PAC-RAT was and prepared us really well. So it's 300 questions. They give you, I think, 5-6 hours to complete it. It's a long day, but it's really, really good. And I think the pants is also 300 questions. So it just kind of helps you like be ready for the big exam. Um, this is a big do as I say, not as I do kind of move. Um, you need to figure out how you study best. Um, I am a maniac, and as soon as I get home, there's a million things to do. Clean my room, clean the kitchen, sweep the floors, mop the floors. I need to go to the gym. I need to go run. Like there's always something. So once I got home, I knew that nothing was getting done. And so I knew from the moment I got to school until I left at 4 or 5 p.m. that I needed to be hyper focused on getting stuff done because I was really going to struggle once I got home. So a lot of the time, because of like SGA stuff and just kind of my own attention span, I didn't pay attention in lecture. I would normally leave lecture like maybe once or twice a day to take care of something else. Um, I was not paying attention in lecture unless it was like a super complex topic or lecture in and of itself. Most of the time, the professors made really good slides, and so I could just use that as a template. And if there was something that I wasn't quite sure about, then I could look it up later, or I could ask the professor if the textbooks were kind of unclear. After finishing the lecture, like while they're still lecturing, I'd pull out my pants prep pearls, and like if any of the content gaps or questions that I had were in the Pants Prep Pearls book, I would just duplicate it over on the slide. I'd study straight off the slides. And it worked out really well for me because I was able to read through the slides once on my own. And then I was able to go through it again, looking at Pants Prep Pearls and kind of comparing the information. So by the time the majority of my classmates already only had one pass of that material that were paying attention in lecture, I already gotten two passes of the material where I was actively learning. I wasn't just listening. I was actively like asking questions, finding answers to my questions. And so it was super duper helpful for me to be able to do that. And a lot of the time, by the time that I came home, I could just work on practice questions with limited success, of course, but I could still just kind of more so focus on solidifying the information versus still building the base. Pharmacology, completely different. I had to make a study guide for every single lecture because pharmacology just did not sit well in my brain. So, yeah, it's completely different. I could not study off the slides for that. But as I said earlier, you need to start with what you had in the summer if it was working and just kind of tweak it as you go. It's going to be completely different. You're going to have to study it a different way to some degree, but start with what you know works. Don't come into this and be like, you know what, I want to start trying Anki. Because what happens if Anki doesn't work? Then you're kind of like starting back at ground zero. So start with where you know and then build from there. I think we're almost done. You need to use study methods that work for you. I can't press that enough. If you need to change your process, that's okay. You're in school. We just hit the fall, right? So you're still in school for another like 11 months. So you have 11 more months to refine the way that you study. So just keep that in mind. Active learning requires active change. If you have to constantly be challenging how you're processing information. So just be aware. There's no perfect PA student. There's 90 of you, and all 90 of you will learn in a different way. Even if you're both making charts, you're going to make them completely different. You'll find people that are great at doing certain things, people who are great at making Quizlets or Anki decks, or people who, edit the slides really well or make perfect charts. You guys will all working together and sharing these resources will make you all the most successful that you can. I couldn't have been successful if it wasn't for like leaning on my classmates' Quizlets. And a lot of the time, my classmates valued my study guides for farm. And so you need to share your strengths as a class. I think I told everyone that I could at the beginning, whenever everyone was super stressed out about being here, whenever they pick a class, they're picking you guys for diversity of experience and value. All of you bring something different to the class. You might have an RN in your class. You might have a respiratory therapist, a speech therapist, paramedics, MAs, whatever. You guys all have a litany of medical experience, which makes you incredibly valuable to each other. But you're only as valuable to each other as you're willing to share. So share your strengths with your class. Carrying over, don't compare your success to other people. If you're a straight A student, fantastic. Best advice I got is keep it to yourself. If you're failing stuff, don't feel discouraged either. Um, you know, PA school is different for everyone. And so just kind of keep your head up, keep your head twisted on nice and tight, talk to your faculty members if that's an issue. But you're all working together to make sure that all 90 of you pass. The competition part is over because whenever you graduate, no one's going to ask you about your GPA or what your grade was for Clin Med 2 or even what your pants score was. Nobody cares. The only thing that they care about is that you have the certification. So let's drop the gunner stuff if that's ever been an issue and be humble, be helpful, be compassionate. You're all going to be coworkers. So keep that in mind. By the end of summer 2024, 2025 for you guys, you'll have seen over 24,000 slides, 60 exams, 20, sims and OSCEs. You'll probably be burnt out at some point. If that number stresses you out, it should. It's a lot of stuff, but you're gonna manage it well. You have all the tools in front of you to manage your time and to be prepared for these. This is exactly what my class did. We all ended up perfectly okay. So just keep that in mind that this is super doable, but burnout is probable at some point. You need to by actively, I mean, you need to have a plan now, but you need to be actively formulating a plan on combating burnout. So, like I said at the beginning, you need to have a social life. Talk to your friends back home. Talk to your family. Visit your family when you can. At the end of exams, you can go home for a weekend. You should. You should absolutely do that. Join running club. Go with a trip or go on a trip with friends the weekend after exams. You need to go do something. PA school, you're a student, and not stereotypically, but typically they would tell you, being a PA student is your life. And in parts it is, as much as being an electrician is being your life. But at some points, you need to be able to step back and reflect and move away from that because you're a PA student right now, but you're not, Abigail, the PA student. You're a PA student who just so happens to be Abigail. Um, Maintain your physical health. It is the stem of so many fixable issues: tiredness, sluggishness, feeling down, constipation. That like there's so many things that like affect your everyday life that could be fixed if you started going on walks every day. So just kind of keep your physical health in check. Keep an eye on it. Make sure that it's not getting lost to all of the studying that you have to do. Seek counseling. It's free, always. And take your mental health days. They don't tell you that you have any. There were many days where I said, I'm just not coming in today. Like I need a brain break. I'm tired. Like I need 24 hours of, not sitting in lecture all day. Um, so I really do want to hear how it's going for you. If you guys have any questions, text me, email me. I'm so excited to hear about, what you guys are learning. Um, Clinical year has been so fun. It's only been a month, but EORs weren't as terrible. I have to remediate my first EOR, so I guess that's something. So I've gotten to deliver 6 babies. I was able to pull them out, uh, help them deliver the placenta, cut the cord on a couple. It was a very enlightening experience. I got to do a lot of C sections too. Um, During one of the C sections, we opened them up, and as soon as we got into the abdominal cavity, the uterus was already open. Um, and you'll learn that it's a risk factor if women have like a transverse, or I'm sorry, like a midline cut to their uterus. That's why they do them, like low transverse cuts, like not the midline. So it was a very interesting experience to be able to watch that. And then of course, like everything else that you see, STIs and all that other junk. It's been a lot of fun. So if you guys have any questions, I'm here. I'm hoping to be around I'll be in Tennessee for the rest of this, so I should be around. I'll try to be on campus some to talk, but if you guys have any questions on like how to handle this, or if you're stressed out and you need someone to talk to, please like find me, email me, let's talk. Like I'm here to help you. I'm not a therapist, and I'm not a clinician yet, but I can be as supportive and compassionate as humanly possible. So, if you guys need anything else, please let me know. Thank you guys so much.